can't mute me.
All right, here we go. We're live. Welcome to today's live stream with Hint. We've got Planstin joining us. We've got Brian Fretwell from Direct Primary Care Associates. Thanks for joining us, everyone. As people are joining, I'll kind of overview what we're talking about today. We're talking about employer health plans, how DPCs can work with specifically Planstin and the offering that they've recently put out there into the world on how to make this even easier. So we're going to kind of get into details today on what that looks like, how you can set it up, and how that could possibly work with your practice. To start us off, why don't we do some intros? Derrick, would you like to go first?
Yeah, my name is Derrick Udy, and I'm the head of group business for Planstin Administration. Planstin is a TPA, or a third-party administrator. We've been around for almost 10 years, and we will be hitting this next month our 1,000 group milestone. So we're not huge, we're not super small, but we are out there disrupting in our space, and we've partnered with DPCs for years, and we're excited to talk more about that today.
Fantastic, and congrats on the milestone. That's exciting.
Thank you.
That's great. Okay, Brian, your turn.
Brian Fretwell, PA with Direct Primary Care Associates, CEO and chief servant, if you will. We've got 4 offices along East Tennessee and Northwest Georgia.
Fantastic.
And I think important and apropos to this particular conversation to say too, that we just eclipse about 3,200 patients and 127 businesses that we work with. So we work mostly in the employer group space.
Fantastic. That's great. Thanks for sharing that. That's really helpful for everyone to know, and congrats. Well, Brian also wears many hats. So we're so glad to have you here and share your expertise with our Hint community and anyone that's listening. I think this is going to be a great conversation. So also, I'm Dani Brown. I lead the partnerships at Hint and get to work with all of these kind of external companies that Hint works with and figure out how we work together. And it's really fun. So that's me. Okay, so let's jump into this. Why are we here today? What are we talking about? We're talking about employer health plans. And let's maybe talk about how that has been kind of difficult in the future, difficult for DPC practices to approach employers that don't already have a health plan set up. Derrick, tell us what you've seen and how Planstin's helping there.
Yeah, so we've seen a couple things in the industry. One is costs have been going up quite a bit. And so if you think about your traditional employer on a traditional health plan, they're seeing increases right now of 10, 15%, sometimes 20 or 30%. Year over year. And that is their second largest expense for most employers after the actual employee expense, right? It's their benefits. So it becomes a big consideration for businesses, and they struggle often to think through that. And I'm preaching to the choir here a little bit, perhaps, given the community, the Hint community, but DPCs can play a real unique role and a space there where not only is it great care, but you're working to help fix the broken healthcare system. You're not on the fee-for-service model, right? So we know that when folks have a DPC, they get better care. We see lower urgent care visits, lower emergency room visits. That helps the claims fund. And so the battle that DPCs have often had, and I think Brian and others out there, is, hey, how do I sell my DPC membership to these groups to grow without steep discounts, without having to really convince them that we can help their claims fund over the long term, and without being seen as this add-on or added cost. And so that's kind of the background, and the things that we'll talk about today will help with that, I believe.
Brian, you mentioned you're now working mostly with employer groups. What at this point, you've done this many times, but what have you seen the struggle has been in approaching these employer groups, and where have kind of the miscommunication, or maybe they don't understand how to work with a DPC? Tell us more about that.
And most employers don't. Most employers, DPC as a concept itself, and even the point of direct primary care is trying to detach ourselves from the man, if you will, insurance and how insurance plays into this. Well, when you're talking to employer groups, that's not their struggle. They're really not trying to change the system. They're trying to understand why, past their human capital, why their second budget line is healthcare. So, one of the ways that we approach that is to get them to understand that they've got a healthcare division, whether they like it or not. That's really where they land. And, some good things that have happened for the direct primary care and the direct care community is other people have taken a look at this exact same problem from Society of Human Resource Management, SHRM. They did a study in 2024 of DPCs through, actuarial societies. And the folks who are already having on-site or direct care clinics, places like, Ford, General Motors, Toyota, Hyundai, at least in our area, we're a big manufacturing area. So a lot of these larger companies have a direct care model already. But how the employers approach that and how they integrate it into their insurance-based system, or how they look at that, and that's for the larger employer groups. You can get to the medium-sized employer groups. For those employers that are less than 500, from 150 to 500, they look at it a completely different way, and they look at it sometimes, as Derrick said, like an add-on. And then you have those folks that are less than 150, or even those less than 50, that look at it like, well, I can't afford anything else. How can I give my folks something? And getting them all in the different stages to look at direct care of what it is. And what it is it's not insurance. It is actual direct access to healthcare, and it's a way to do a handful of things. Those handful of things are, we look at it on our side as clinicians as the access to care part. But on the other side, it's, absenteeism, it's presenteeism, it's productivity, and those are the things that, depending on who the stakeholder is in the decision-making process, is how they look at what direct care is. And that's a lot, but that's just a start. It really, there's a lot to it.
Just to tell a story, I was talking to a DPC earlier this week who said, "Hey, Derrick, we've got this large group. They had about 1,000 employees. And they've been with this DPC for a while, but they had it as an add-on, and they were grandfathered into very low prices. And so they were already getting this sweetheart deal, but they got their renewal and it was up 20%. Mm-hmm. And so the HR manager of the company was going to the DPC owner and saying, hey, we need to cut prices even further, right? And so that's the struggle that DPC owners face. I see Brian nodding. I'm guessing there's probably been some similar type conversations. Even though you're adding real value, you're competing, and so it's, hey, how do we make DPC really the center of a plan for the employer groups versus that add-on?
Yeah, that's great. I like that story. So let's kind of connect the dots here. Brian, how did you find Planstin? How did you find this Care Plus? What drew you to that?
It's actually a great story. One of our employer groups that is spread out over a couple of the states that we cover is very pro DPC. We've been through a couple of different insurance brokers with this particular group. And what happens a lot of times is the brokers are, yeah, we work with DPC, and they'll come in for the first year, and then the next year they're like, oh, you got to cut them to lower your rates, or to make this work, you got to cut DPC, because again, they would look at it as an add-on. Well, they have a person who actually works at this company that is a stalwart, and she is the one who actually found Planstin. Because she wanted a TPA that actually worked with DPCs, and Planstin jumped out. So she's like, hey, will you check these guys out and look into this? So I did, and I called Derrick and I said, hey, I kind of had to swim upstream a little bit to get to him. But I was like, hey, how do you guys work? How do you guys work with DPCs? He's like, well, we have our own DPCs, and we've built this plan around it. And And the more we talked, I was like, holy cow, this is a lot, this is going to resonate with a lot of the DPCs out there. This is too good to be true, right? Because how many times do we hear that story, right? This is too good to be true. So we got a company, one of our groups, there's about 325, and they're spread out along, really they're our widest, footprint in geographic locations, because they're all over. They're a teachers group, and they don't mind, me talking about them, because I use them a lot to explain what, the Care Plus program is with Planstin to other employer groups. But we got them enrolled and had been using them. And like most things, I like to see how things are going to work out, how people like it. And we do data analytics on everything that we do. And, we were random sampling, that particular patient population. And we were getting back, pretty quickly in the 80s to 87% initially in patient satisfaction. And then after about 3 months, it just jumped up to over 90. And that's what we look for. And the reason it was at 80% was because they didn't really know how to use it, because it's just a touch different. And whenever you change anything, whenever you change anybody's operant conditioning, right? Whenever you change that dinner bell to a different tone, there's a mildly different response. But it doesn't take much. It didn't take much for them to get on. And then we had a couple of other groups that we introduced to Planstin, and they started using them, and essentially the same response. And then after that, it's just been it really has been fantastic. And I can't wait to jump into what that looks like. But that was the introduction to Planstin.
That's great. It's great to hear. Also, it's too good to be true. That's why they're not using it, right? It's too good to be true. Derrick, tell us more. Tell us more about Care Plus. How does this work? How is Brian using this with his employer groups? Tell us.
Yeah. So speaking of this group that Brian mentioned, I remember them talking to them as well. I was involved a little bit with the sales process there. They were struggling to recruit and retain. As a lot of business owners, that's one of their struggles. And as DPC owners, you should just know intuitively we're in a tough industry. We're in a tough market. Unemployment rate is still pretty low. People can move, they can go somewhere else, and they'll go for better benefits. And so this particular school was saying, hey, I've got to compete against other talent, other schools around us, and we're our deductibles are high, and we need a better plan. So that was part of it. The way Care Plus Direct works is it puts your DPC at the center of the plan. And so instead of being an add-on, we actually take your DPC and we build it inside an ACA-compliant level funded plan. And so this takes care of all the ACA concerns that groups have. So this can work for large groups. And that helps from a compliance perspective, and that helps you get in the door. But think about that for a moment. You're the center of the plan. Think of yourself as like the network. And so I think that's the advantage for you as a DPC owner. When you're built into the plan, as you're not an add-on, you are the plan, right? And so you can also build in the right cost to sustain your business, right? So you could tell Planstin, hey, if I bring you a group, or we bring a group together to Planstin, these are the rates that we need built into the plan. And so we build those in for you. The other thing we do is we layer in care coordination. That's included with all of these plans. And these two together work to stabilize rates over the long term for all of our groups. And how this works is for the members, and I'm going to talk about the group and talking about the members. These are two different things. For the employees that go on these plans, obviously, if they go to the DPC, their membership's included in the plan, so they're not having to pay a copay or something out of their pocket. But in addition to that, if they use the care coordination team, what we've said is we will waive their deductible and waive the co-insurance. So the plan on the surface has a deductible. It has different co-insurance amounts that you can sign up for, but those can all get waived as long as you use the care coordination team. The care coordination team is trained to go out there and find the best rates in the market. They will look for things like cash rates, and they'll do what they can to make sure that we are saving the plan over the long term And that makes a big difference, right? So if there's a knee surgery that the employee would just go somewhere for and pay 90,000 for and go to a hospital for, then the care coordination team can direct them to maybe a surgical center, for example, and maybe that's 15,000 or 20,000 instead of the 90,000. And so that becomes a large cost savings for the employer and keeps costs stable over the long term. But we pass on to the employee some of that benefit. We say, hey, if the employees are participating in helping to work to build a better healthcare system, right, we want to reward them. And it's interesting because we've got other plans that use care coordination, but there isn't a carrot, right? And in this particular plan that we're talking about today, there is a carrot, and there's a big difference. You go from about 30-40% of the folks or the employees using care coordination to roughly 90-95%, because now there's that incentive to do that. And so works well to stabilize rates for groups over the long term. So they're not seeing that 20% increase, but it's great for the employees as well.
That's really interesting. Brian, I'm curious to hear kind of how employers have responded when you approach them with this.
Mm-hmm.
What's kind of been that conversation, and tell us how they've, received that information.
Yeah. It changes our whole talk track. When we would approach employer groups before, we would tell them about, the benefit of, DPC and what it can do for you. And now we're able to, and we had many, as a matter of fact, we keeping track of these folks. We would have folks that say, well, that's great, but what if, right? What if something what if something happened? So when we introduce them to the Care Plus Direct and we say, we're going to build you a medical home for your company. We're going to have either an on-site or a near-site clinic for you that is yours, that you and your folks can use however you want. And if something else happens, something around that, and we need to refer you somewhere, or you need to go somewhere, we think it's the future of healthcare, and having that care coordinator, care navigator in there. Actually, we at Direct Primary Care Associates, we employ RNs to help with our care navigation of our patients already. Having that built into the plan, that's just that extra layer of, hey, you're going to get the best care, and we're going to help you navigate this very, very convoluted system. So getting back to those companies, to get them to understand, number one, the benefit of using direct primary care, and then on top of that, having a wraparound, if you will, insurance policy that now has a care navigator in there that can help, that works with the DPC to make sure that that patient is getting exactly what it is that patient needs. And when they access those two things, you now have no copay and no deductible. And that's where this is too good to be true. This can't work like this. When in fact it does, and it works really, really well when those two systems are engaged.
That's really cool. Derrick, is there a limit on size of companies that can take advantage of Care Plus, or tell us?
Yeah, so for Care Plus Direct, we need 5 employees to sign up. There is no limit as far as the upper end, but we do need to do underwriting for these groups. These are our level funded plans, and so we're going to need to have 5 as our minimum for that.
Perfect. Great. That's helpful. And I mean, this is just, again, too good to be true, and feels like, there was kind of these health plans living over here and then employers living over here. And now just bringing, like you said, Brian, to bring that into the conversation instead of having to kind of, figure out the follow-ups and maybe bring different people into the mix to kind of fill that hole. You're really presenting kind of a full package, right?
Yeah.
And yeah, go ahead.
I was going to add, Dani, what's interesting is, if you were to look at over the last 10 years where deductibles have gone or where prices have gone, right? They've doubled. And so it used to be that a silver plan on the marketplace might have a $2,000 deductible. That's not the case anymore, and so the average plan that most employers are putting in front of their people today are $4,000 or $5,000 as far as their deductible. and they can be higher. But the average American has $500 or less in their bank account, so to handle some sort of an emergency or issue. And so it really is, if you think about it, the way we're doing healthcare today is kind of backward, right? We put a high deductible plan in front of our employees and we say, hey, good luck. And then we wonder why the bankruptcies for medical purposes or reasons are going up, right? And so they feel like they have to hit their deductible before things can then become kind of quote unquote free for them. And I've heard that, I've seen that in the industry, right? Like, hey, I've hit my deductible, so now I'm going to go do all these things that I've been wanting to do. I'm going to get my knee checked. I've got this mole I want removed. I want all these things done, right? So I'm going to go do that because now I've hit my deductible. And really what this plan does is it just turns it upside down or reverses the order, right? It says, hey, all the things that you need to do, we want you to be healthy. We want you to take care of you, because that'll actually result in fewer, bigger claims downstream, right? And so you need to go get that mole removed. Well, you know what? Brian over here at DPCA can help you with that. They can probably do that right there in their clinic, right? And so you can go do that. You don't have to pay a copay. There's nothing that you have to do out of pocket. You need to go get your knee checked. Go get your knee checked. And if Brian says, hey, you're going to need to get an MRI, guess what? We'll just call care coordination and that'll be free for you. And so I think that's an important distinction, right? Now, if there is an emergency and you're going to the emergency room, yeah, your deductible is going to apply, your co-insurance is going to apply, and we tell employers, hey, we encourage you to offer or even cover with the money savings here, some that often our Group C cover some sort of hospital indemnity plan or an accident plan or critical illness plan, so that it helps bridge that gap. But the reality is, on a population of 100, you're not going to see too many emergency room visits, but you really want to take care of all your employees for their everyday needs and the care that they need.
Yeah, I love that. Like you said, switching kind of the focus. I mean, that's exactly what DPC does, right? Spend the time and let's talk about all the things instead of just one thing. So love how this just is so supportive of the DPC model and just true principles, and really just think this is a great offering that hopefully many of our DPCs can take advantage of. Okay, I have some more questions quickly, but they're kind of two different avenues. So Brian, I'm going to start with you. So this is kind of taking this a different direction, but if a DPC is considering working with employers that hasn't before, what would your advice be to them as they're getting started with this scary talking to employers?
See, talking to employers, if it scares you, that's exactly what you should do. The thing that scares you the most, the thing that's the hardest thing to do, is absolutely the thing that you must do today. All right. And so,
advice.
But it's the truth. And go find that employer. I'll tell you exactly. Here's the magic sandwich. Okay. Let's put this together because there's multiple layers to it. Number one, who's your favorite patient to take care of? Who is that patient? My favorite patient to take care of, and this is why I love employer groups, is blue collar men. You go into any medical office in this country, 75% of the people who are in the office are women. Right? I take you to the emergency room. 75% of the people who are in emergency rooms are men. Right? The reason is they don't take care of themselves. I like taking care of men. That is my favorite patient to take care of. So what is my unique value proposition? I love taking care of men and I love transparency. So I want to go into these employer groups and I want to talk about the men that work in there. Now, this is not to say that we ignore women. That is not what I'm talking about at all. Okay. But these employer groups, like, I want to reach those folks that are working in their company that just never go, because they don't go because they don't know how much it's going to cost. They don't surprise bills. This is where I love Planstin too. Literally on their insurance card, they guarantee no surprise bills. I love it. Like Derrick was listening to me give a speech, and he actually emailed me as I was giving a speech about these surprise bills. And he sent me a copy. It was fantastic. So I actually use that now, in my thing. Like, look for the insurance company that guarantees no surprise bills. You can't find them except for, you're talking to the guy right now. But the other thing about talking, the other part of this sandwich is, what pain are you going to relieve for them? Every company has a different pain. There's a reason why they're giving you time. A lot of companies, they get inundated all the time with sales pitches And the most important, the most precious thing that they can give you is time. So if you have an opportunity, if an employer group says, I'm going to sit down with you, DPC out there listening, and I'm going to give you the time to talk to me about your product, that's because they have a pain, and it's your job to figure out what that pain is. Number one, they need to know you, and they need to know what it is you do, and they need to know your why. All right. The next thing is why are you allowing me to talk to you right now? Is it because of absenteeism? Is it because of retention? Is it because of attracting the right clientele, like Derrick was talking about, or the clientele, the right employees, right? You know, why is it that we're here? Is it because of your cost? Well, how? And that's what you want to focus on. What I see a lot of DPCs making the mistake of talking to employer groups is they just come in and they vomit. Hey, we do this, and you don't have to wait, and it's all of this, and it's and we can do this, and we can do that, and they're looking at you cross-eyed like, I don't even know what you just said. My problem is I just lost 20% of my workforce to my competitor over here because they have great benefits, right? You have to uncover what their pain point is. And this is another thing that you know, that we do. We really try not to sell the very first visit to an employer group. We try to get them to know who we are. We give them a very topical idea of what it is that direct care can do. We uncover their pain point. And then we also educate them on the questions that they didn't ask us, the things that we know that they're probably dealing with too, like Derrick was talking about. We can just about guarantee everybody in our area on average right now is about an 18% increase in our area. And while a lot of the stuff that's out there in the DPC world, a lot of the groups and the things that we read about says, oh, we're going to cut down what drops on your insurance plan, and we're going to, change claims, and we're going to, guys, that's not working. The insurance companies are not caring about that right now at all. They're publicly traded companies for the most part, so they are going to make profits, and it doesn't matter now that, direct care is in there. And I know I'm going to get some heat on that. I'm looking for some comments for those other DPCs. I say, Brian, I completely disagree with that. Well, I say, come to Southeast Tennessee, Northwest Georgia, Northwest Alabama, and I'll show you that it is not making, that big of a difference, and the insurance companies are telling us such. But uncover that pain point. But then on the other thing is we always ask to come back and meet them in just a couple of days. Take the time, guys, to step away. Take your notes. Take what you talked about, the pain point that they uncovered, and come back with that beautiful sandwich, the way that you are going to alleviate their pain, the reason that they gave you their time, and tell them how your direct care practice can alleviate that pain, and magic happens.
Yeah.
That's the advice I'd give.
Hey, mind if I jump in, Dani? By the way, I love the guarantee comment. I do want to clarify that we guarantee no surprise bills is on our cards, but it's if they use care coordination in advance, right? And so that is on all of our products, not only this product we're talking about today, but other products. The other thing I would add is I loved everything Brian said, and in our sales process, we're also asking the why and really trying to understand the customers. But when I do talk to DPC owners, there's a little bit of a fear. Like Brian said, that's probably the thing you should be doing, going to BNI groups, going to your chamber meetings, getting involved in the community, hosting lunch and learns. But sometimes you're not sure what to do or how to present that. I would just highlight that one of the things that we're doing at Planstin is we are co-branding or creating these Care Plus Direct plans for the different DPCs that want to work with us. And so you can have your own material. We'll give you the right material to help you with a lunch and learn, for example, for RAT cards that you can give out to business owners. And so we'll help you get started on all of that. And if you call together a big group of businesses, we'll help you. We'll dial in or we'll fly in depending on where you're at or what the situation is. But you are busy running your practice. Just know that we can be a solution for you, and this isn't meant to be adding a lot of work. We really want you to hit the easy button.
Perfect. Okay, we got a question coming in. Derrick, I think this one's for you. I'll read it out. One of the things the ACA did was create a situation where for smaller groups, we're flying blind on the risk in the group for lack of claims or other data, and therefore complicates knowing the risk we're facing. Do you have a way of understanding the risk to underwrite appropriately for smaller employers?
Yeah, we do. We use a third party to handle all of our underwriting, or third party tools, I should say. We handle it in-house, but we use those tools. As long as we have 5 people, we can do the, HIPAA rules as they are. We need 5 to do it, but we can do that and we can understand the risk. Our stop loss carrier understands the DPC model and the value as well as the risk of this plan, and so we can handle small groups. That's not a problem. I was actually looking before this call to see what the smallest group was that we had on this plan, and we have a 10 life group that had 5 employees sign up for Care Plus Direct, and that worked out just fine. And they actually, because the employer was covering a good portion of the contribution, they got a discount on their rate. So that we do that too.
Great. Thanks for the question, Robert. That's great. I have, Derrick, another one for you, just from me. How, if we have Hint customers that are interested in learning more and signing up with Planstin for Care Plus Direct, what do they do? Where do they go?
Yeah, they can just reach out to me. I've had some people, reach out to me via LinkedIn and message me, and then I can, get you connected with our team. I have a team that'll connect with you and meet in more detail about the product itself, answer questions that you might have, walk you through the process. There's no contract that you have to sign. All we need is your logo. We need your pricing that you want baked into the plan, and we'll get to work. We'll build it out.
Great. Brian, do you have any kind of closing thoughts that you want to share?
I'm always looking to innovate. One of the, I think a founding idea for me is creativity in the space. And this is why I love DPC, because you talk to one DPC across this country, you've talked to one DPC. We are all a bit different. I see Derrick kind of smirking a little bit down there like, yeah, because I talk to a lot of other DPCs too. And the one truth about this space is the creativity. And as you're trying to fill the holes of what a lot of people have fear of, and that fear, especially with employer groups, is what if? Well, what if this happens? And what if that happens? And finding, number one, somebody who wants to work with DPCs. In our area, that's been really tough. We've had a really hard time with brokers, trying to integrate in with their plans. They were fine if we were bringing groups to them, but not necessarily introducing their groups to us. And then trying to work with other people, trying to shoehorn ideas in a way that other insurance vehicles could help or could benefit the companies we were already working with or had a relationship with, or trying to grow new employer groups. And then, Planstin comes along and has this, exactly what he said. It is a plan that's actually built around DPC instead of DPC trying to fit into it. And that's the difference. What I would tell you is, go to their website, check it out, read. They have a fantastic website, lots of information, lots of, resources that are already built in there, that you're not having to reinvent the wheel. That really makes it easy. And to go back to the previous question, how you can talk to employer groups now is so much easier, because when they start with the what if, well, we have something for you there too. Right. So that's what I would say.
That's great. You could literally talk all day about this and just nonstop. We love it, Brian. Thank you for being here and sharing. Derrick, do you have any other kind of closing thoughts that you want to share?
I'm just grateful to be on with the Hint community. We are trying to rebuild a better healthcare system, and we've very much see DPCs as our partners in that space, right? We're working together to make things better. So we're just excited to be here today. We're happy to grow with each of you. We want to help you grow. And I think that's important. So we want to see you thrive and do well. And so let us help you do that.
Awesome. Love it. Again, thank you both for being here so much. Thanks for those who joined us live and those many of them that will watch later on the recording. We appreciate you all. So please reach out to Planstin, reach out to us if you have any questions, and we can always direct you to where you need to go. Thanks everybody for joining. We'll see you next time.
Thank you all.